There's a few things I think that are helpful. Number one, pretty quick compressive wrapping to try to minimize swelling. Swelling not only hurts, but it also restricts motion and can make it more difficult to compete safely as one moves forward. Number one. Number two, ice application. Applying ice to minimize swelling, to reduce pain, to keep any bleeding that may occur inside in the area to a minimum is all helpful. And then some form of immobilization. So perhaps over a compressive wrap might be some form of a removable ski boot, we call them cam boots, or even temporarily a splint, which could be applied either with plaster or fiberglass. After a short period of immobilization, early motion. So perhaps with a trainer, either later that day or the next morning, trying to help regain motion, make sure that the Achilles tendon doesn't get tight. It's an opportunist that often does try to get a little crampy and tight. So to try to keep that mobile is helpful. To try to massage out any swelling that has occurred to try to minimize those restrictive effects. And then I would say finally, some low impact repetitive exercise that may prove helpful, such as simply riding a stationary bicycle. The repetitive act of up and down motion of that ankle, trying to keep the muscles with blood flowing, proper movement of joints, mobilization of that swelling out of the limb. All of these things will hasten a recovery.